All right, I'd like to call this meeting to order for Health and Human Services on Tuesday, December 9th at 6:30. Roll call, please.
Kay Wilson,
Here.
Tweed Schuman,
Here.
Marshall Savitsky,
Here.
Chuck Van Netten, Jeff Haney, he's excused, Lorraine Gouget, Dawn Pettit, Dr. Sabrina Dunlap.
Here.
You have a quorum.
Let's stand for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Can we have certification of compliance with the open meeting law?
This meeting was noticed to the media and the public as required by Section 19.84 of the Wisconsin statutes.
Thank you. The agenda's been set. No public comments. And I'll entertain a motion for approval of the minutes from our last meeting.
I'll make a motion. I'll second it.
Motion's been made and seconded to approve the minutes from the last meeting. Any further discussion? All in favor?
Aye.
Opposed? So carried. Julia, do you want to address number 9?
And Ms. Gouget.
Yes, I will. And I will come on video here, hopefully. Okay. Thank you, everybody, for coming tonight. I know the weather was pretty tenuous. I'm thankful, actually, that it looks like we're going to get less than we were expecting. Just wanted to bring up, I know when Mike and I were talking early on, when he first came on board, we talked about the frequency of what these meetings need to be and potentially the timing. And decided to put this on because as I'm looking at January, the meeting ends up being quite early in the month. Not a lot of data is there. We don't have any end-of-month reports, and it comes right after a lot of time off on holidays. So I was looking at the January thinking it would be a good time to probably say, let's not meet in January and meet in February. But the other conversation that we could have is, do you want to continue to meet monthly? Would you like to entertain a less frequent schedule? What we have to do is from public health, board of health. So we have like a combined health and human services boards. Human services doesn't specify any frequency of meeting. It just specifies everything we need to get done. Human or health boards, you have to meet at least quarterly. If we change the frequency of our meetings and maybe went every other month, it could make it so that the meetings are, at least an hour long, as they have been, but we would probably want to kind of hone in and have you doing reading of reports and really highlight some key things. The other thing is if we didn't meet quorum within a quarter, we may need to call a meeting. So that would be the risk of moving to an every other month. So that's the first thing is frequency of the meetings. Do you want to continue meeting monthly? We can continue to do that. I just wanted to bring that up. But I also wanted to bring up that it would probably be good to just cancel January's meeting and be ready to go in February. Is there any discussion, any thoughts on that?
Well, I do, I guess, Julia. I know that Health and Human Services and all the years that I've been on county board is one of the largest expenditures in the county's budget.
Mm-hmm.
And if this committee doesn't look at it often enough, I'm just afraid. I know we have good people that are in charge, but we're elected officials representing all the districts within the county. And Ms. Gouget, of course, is representing the tribe. We just need to stay on top of this.
Okay.
That's the way I feel. I mean, I know I'm only 2 miles from here for a meeting, but And I've missed some meetings myself, but still, I just think that the county, it's our oath in office to oversee this committee and this type of expenditures within the county's budget. That's my thought.
I know with not holding regular meetings, something might come up in the month, and then you'd have to call a special meeting, and special meetings are more difficult to get a quorum for. So if it stayed on schedule, I think that would be to everyone's advantage. If it's difficult to have the reports come through every month, they wouldn't need to be maybe as detailed and as, I don't know.
Totally, completely here, and we are willing to do that. We just wanted to be able to bring that option forward as we were looking at everything.
I would not be against canceling January, though, for the specific reasons that you gave, that it would be after the holidays, after vacations, early in the month, and you wouldn't have anything to report. And then watch something.
I'm around for that January meeting, I guess, so I don't have any problems with it on my end. And as for the rest of us on Health and Human Services, we're only here till April. If we get reelected, maybe it's something that this committee can relook at later on next year if they so choose, depending on who gets in, you know what I mean? But for now, I don't mind meeting monthly.
Okay.
Did you have something, Lorraine?
Yeah, I just wanted to add that when we meet regularly like this, monthly, it's good to have that dialogue and see where issues are at, because you never know what's going to arise in the community and what's going to happen. And with everything that's happening with our government, we don't know what's going to happen there either, so you just don't know. But I do believe that we have to stay on top of things when it comes to the health of our people, because we don't know what's going to hit our community. So I like that monthly meeting, but in January, take a break, that sounds good to me.
And frankly, you know, moving to every other month gave me a little bit of pause, and just because when things do come up, and it is nice to know that we have a meeting coming that we can discuss things at. So, but we wanted to be open. There's a number of counties that meet every other month, and we wanted to be open to what the needs are of our county. So.
Do you think that we need to keep it so that we could have a January meeting, but we could also cancel it if there wasn't a need for a specific report or a specific action?
Well, and frankly, if we want, the one action that would come up if we had a January meeting is we would be talking about fee schedule, because the fees for the DAT cap from the state, so that's the all of the licensing, did go into publication and will take effect. So that is something that I would be bringing forward in January. It can wait till February, but we could get that done in January and then, you know, have a short meeting, kind of focus in some areas and get that done. So that could be something that we think about.
What do you think? Keep it in January?
Sorry, I have a question. Is there potential for not having quorum in January?
I'm not sure about that.
I mean, are people going to be gone? Do people know they're going to be gone?
So Marshall said he's going to be there. I can't really tell from everybody else in the room.
I'm not going anywhere.
But as far as I think everybody makes a good point that we do need to do these every month. This is HHS has the biggest budget in the county that we need to stay on top of.
So let's have our meeting. I make a motion that we continue to have our meeting in January, but that the reports can be abbreviated if necessary.
Okay.
Or as necessary.
I'll second that. Chairwoman.
A motion's been made and seconded to keep the January
And the monthly meetings
and the monthly meetings,
as scheduled.
yeah, as scheduled.
Okay,
All in favor?
Aye.
I
Opposed? All right, so carried. All right,
okay.
thank you.
Thank you. I just wanted to make sure we were all on the same page with things.
All right, let's move on to number 10, LCO. Lorraine, do you have anything to add? Could you turn on your mic, please? Thanks.
I just wanted to update as we're growing with our clinic now. We are seeing more patients and we're providing more care. And we have, I'm just going to update the staff now that we have in place. We have 1 MD, 7 NPs, 1 PA, and our specialty providers, 3 podiatrists, 1 chiropractor, 2 optometrists, 2 mat providers, and 7 dentists. So we're growing our team now to keep providing the care that our people need, and we're trying to, the waiting list was so long, we're trying to address that so we can bring them in and take care of them as quickly as we can. And I wanted to also mention that some of the things that were found was, there was cases of the COVID, there was 19 cases of COVID-3, I think they call that, 3 COVID. But there's 19 cases that we had in December, and 5 rhinoviruses, which more along the line of cold symptoms, and common cold cases, and then 1 strep case. So I just like to keep an eye on those kinds of things, because you never know what's happening, like with measles, stuff like that. We got to watch everything and watch our people in our community. So, and then we hired a new assistant health director, Mariah Austin. And she comes to the clinic with experience and knowledge in Indian health, so we welcomed her onto our team. And then I wanted to ask too, because I had a chance to talk to our elder director, and I'm not sure if anybody knows if we have any kind of resource or anything, but if a person needs care and doesn't qualify for some of the resources that we have, but in this particular case, this person's coming home now because her time is coming to the end of her journey now and wants to come home to die now. Do they have any kind of service or resource for people who need that 24/7 care at home that you know of? Anything along that line? Anybody?
Sabrina, do you know? Wouldn't hospice?
Well, unfortunately, I think we have a wonderful hospice, but there's no inpatient hospice. But if a patient gets enrolled in hospice and they have needs that their family can't take care of, they can have a certain number of days in the hospital. But no, I don't believe that Sawyer County has any in-home or any inpatient hospice at this time.
But your person is going home, correct?
Yeah, the person who needs that care is going to be at home, not in the hospital, not in nursing home or anything. Just the family's not able to provide everything that's going to be needed. I was just throwing it out there to see if anybody knew of any kind of resource.
Lorraine, I think the big thing is to be able to enroll in the hospice programming, to be able to figure out what things are available to provide assistance, because there is quite a bit that can be there to help. And then, like Dr. Dunlap had said, there are potentials for inpatient hospice along the way. It may need to be at a different facility that would provide that. But really, even if they don't enroll in hospice, talking to hospice providers to find out what is available, I think is really the next step.
Sounds good. And then they are providing, there's 140 meals that they provide, so they do 70, and they have 2 routes. One goes up Post, one goes around Lake that way. So they provide 140 meals, and then there are those who come to the site in reserve to come and eat. But it's going to be less now because of the weather. But I also wanted to ask, they had some changes with DHS, and they need an MPI number, and she's having a hard time going through that process of getting that established. So if anybody can help her with that, she would appreciate that.
Which program is that?
Well, the changes that came through DHS, there's an MPI number that's needed. And
On which program?
for the elders program,
Okay.
and so she just was asking if anybody knew how to help her with that, to set that up. She would appreciate that.
If you can get her in contact with both Carrie and myself, we can maybe help process through what that looks like.
Oh, sounds good. And then December 18th, they're having the elders Christmas dinner, and then the tribe is having December 21st, a Sunday, 12 to 4 at the casino, an elders dinner. So, and 11 to 1 on the 18th, reserve. So I just wanted to share those few things. And then we do have a food shelf now that's been set up, and Tuesdays and Thursdays, 9 to 3 in reserve at the old Elder Center, and then the first Saturday. So we're doing that. And then when it comes to our veterans, we're making care packages for them. So we're going to send them out. So different ones in the community are helping to put that together. And even our young people are going to help with part of that. So then we can send it to all our veterans. So I just wanted to throw that in there.
Marshall, do you have anything? Chuck, do you?
I was texting with Marshall. He's having an issue. He couldn't, something about it's locked him out. He can't like do something while he's driving. But he brought up a point back on this other one for the frequency of meetings, that what about changing our time? Because 6:30 is very late, and it's hard for people that have jobs and then they have to go to their home or whatever. If we could move that up, possibly this would help for more people to be able to get here to come straight from work, like move it to 5 o'clock or something like this instead of, and maybe that would help.
Oh, yeah, he's still struggling. That was the other thing I had on there. I wasn't sure if you guys wanted to wait until April or think about that now, so.
Yeah, I'm on safe driving mode for some reason, though I'm not driving, but I think a 5 p.m. time would be better for me. I don't know about anybody else. I just shot check a text and didn't know what the rest of you thought about that.
5 o'clock would be much
That would
better for me.
eliminate me,
Oh, would it?
because I have a library meeting at 4:30 to 6.
Just move that one.
Yeah.
How about 5:30 for people who do work until 5?
Yeah, and I can let you know the original my understanding of the reason for moving it to 6:30 at some point was to be able to get more public attendance, but obviously we see that doesn't necessarily happen at this later date, so or later time. So
Let's address this in April.
Okay.
On to administration. Mike, did you want to talk about the strategic plan or?
yeah. Is there, sorry, did we want to go back? We didn't talk about, I didn't know if there's anything from the Senior Resource Center.
No.
I'm on that board also. So
Oh.
if Marshall can't speak, I can tell you what we did.
Okay.
I don't have anything. Liz, go ahead.
Okay, we made a motion to move the meetings to Tuesday night, so Ron Buckholz could join the board. So starting at our next meeting, Ron Buckholz is going to be representing the southern part of Sawyer County. We're trying to get Joe Bodo on board, have not heard back a commitment from him. But there were openings on that board, so we're working on getting those filled.
Good, thank you. Sorry to have jumped over that. Who's going to talk about the strategic plan update?
I can go ahead and do that. So, excuse me, the strategic plan has been put in. I did start with the overall strategic plan of the county, and that is what is on your screen right now. For those of you who aren't as familiar with it, looking at responsible, sustainable spending, budget balancing, looking at efficiency of operations and innovations, affordable housing, homelessness, employee retention and staff development, community care, mental health, and substance abuse problems. So just wanted to that's an overview of the priorities of the county board. Then moving into the department, Health and Human Services area, when we obviously can't choose absolutely everything to work on. I imagine that as we move forward, we'll end up adding a few pieces along the way as we accomplish some other tasks. So we are looking to increase revenue streams and reduce mental health out-of-home costs. Under operational efficiency and innovation, we're looking to create efficient processes by using our new electronic health record. And in workforce retention area, we are looking to improve employee engagement and retention. And the strategies to get us there, we will, with the department goal of improve employee engagement and retention, I believe that's the one that you've got up there, we'll want to provide opportunities for all HHS staff to connect as a group at least 2 times in 2026. We'll develop staff appreciation with focuses of celebrating years of service, recognizing professional weeks and months, recognizing outstanding work through the Blue Ribbon and other appreciation efforts, and implementing the 30, 90, 365-day check-in that Mike has put forward for us for new employees and act on those recommendations. Any thoughts in that area, or any like, oh, I wish you guys would have put in X, Y, and Z?
Chuck?
The same thing that we had talked about before of having exit interviews, I think they're huge. Because we do it with my organization, that if someone leaves, as long as I'm not, terminating them for some kind of crime, but normal for turnover to find out where we're going wrong so we can police ourselves. I think it's very important.
I'm gonna pull in Mike on this one. Mike, is that I believe that is a standard that already happens with HR, so it's not happening directly with the supervising employee?
It would be more of an HR function to do that. You could do an internal one in your department to gather some data that way, but yeah, that would more be on an HR, more of a global.
And isn't Rose already I thought Rose was already doing those.
I don't know that she's done them for everyone. I know she's done them. But
Okay.
We can work on that as far as a human resource strategic plan to make that a recommendation.
Although it'd be more advantageous for people within their specific department to discuss.
So there's two thoughts.
Problems?
Yeah, there's 2 thoughts on that, Kate. Because sometimes they're not as forthcoming, and maybe it's a dual exit interview. Sometimes people aren't as forthcoming with the person who's directly supervising them, and are much more forthcoming with a third party, like a HR like, oh, things weren't going well at all because, and then you can like identify that I was doing something that was not great for the employee or maybe the department that somebody might not tell me directly. So I totally agree in exit interviews. I'm not trying to pass the buck on that one at all.
So then does HR bring that information back to the department? Okay,
That's typically how it's handled.
okay. Did
Okay,
you have
guys.
something?
I did. Julia, what is an example that we are going to increase revenue streams
Oh, we're getting
for the
there.
Health and Human Services Department? I see it's listed here. I just don't
Yep.
know.
We're getting there. We're getting there. We're only on improving employee engagement. Each one of these has a page.
Oh, okay.
So really, we're on employee engagement and retention. If there were any strategies in that you thought we should be tackling.
Are we fully staffed right now?
We need to work on mental health counselor, even as a part-time basis, and and I'm trying to think. And then there is a position that we're looking to post. But otherwise, we're doing well, and I hate to say that out loud, so I'm going to knock on wood right now. We've been doing quite well with being able to hire. Our new positions and new hires are catching on quickly and are good fits. So, yeah. Now the goal is to keep everybody. But we also want to allow people to get promotions and move to areas that are good fits for them as well. So we'd like to take that into account for the county.
Yeah, because there was a time that it seemed like some of the people were here forever. You know what I mean? They were here all the time. They were.
Yeah, we're I think down to maybe 2 people who have 30 years now. Melanie and Kathy. I think our because Kathy Garby has left as well. So, and then Shauna's right up there. Okay, let's go ahead and move on then to the next goal that is on here, and that's creating efficient processes with the new electronic health record. We are looking at implementing strategies to reduce duplicate documentation and create one source of truth for client information and billing. What we have is kind of multiple areas where information can be kept and some duplicate areas of documentation. So we should be able to create efficiencies through that process. And then we're also looking to, and are in the process of a centralized referral process that will streamline the assessment that comes through and duplication of tasks. So many times what will happen is they might get referred to one program, they ask a lot of questions in there, and then they get referred to another program they might be qualified for, but kind of get the same information asked again. So we're just trying to reduce that duplication. Also, through the centralized referral process, we want to make sure that we're identifying the programs that that would be best for them and make sure that we don't have any gaps in their services. So those are the 2 strategies of efficient processes that we'd be looking at. Anything else that anybody wants to bring up?
I have one more
Okay.
question.
Chuck?
I have one more question.
Yes, go ahead.
What is for like your supervisors, how many people report to a supervisor? What's a normal, a ratio? Is it how many per is under the supervisor?
So it's dependent on the program. So I would say that every supervisor has at least 6 or 7 at minimum reporting. And I can bring those exact numbers back. In some programs, there is such a wide range of different things that are happening, and the wider you get with the number of people, number of programs within that supervisory area, the more complex it tends to be. Is there specific information you'd like us to bring back on that so that we can talk about that in January? Or I can bring back each department?
What I would like to see is like the data, the numbers. So
Okay.
in our organization, we actually paid a consultant to do these things, and they came up with that a supervisor can actively supervise 12 employees. When it gets over 12, then there's an issue. And also what we had that we streamlined was different supervisors supervising the same employee, because they have different tasks and they have different things. And so they're kind of like you're talking about, having duplicate paperwork and duplicate things. It straightens everything out if that employee reports to one supervisor, not more than one.
I agree. That gets confusing. And we try to reduce that as much as possible. And I don't know that we have a whole lot where that's happening right now. What happens is if they work in two different programs under two different supervisors. Oh, I just lost my image here for you guys.
Tweed,
So yes, I can bring that back for the January meeting.
Tweed
Okay,
has a
and-
question.
Yeah, Julia, do any of our supervisors or directors within Health and Human Services, do we share them with other counties? And is that being more efficient? I know it would be maybe more cost effective, but are they always available?
Okay, so and so we can kind of cover that. Shauna is a good example of being shared because we are through a consortium. And Shauna, do you want to just talk about how your supervisory works? Because it is a little bit different than everybody else's.
Sure. So most of the counties in our consortium have a supervisor, and we're responsible for supervising our local staff. But then each of our supervisors has an area of focus. So we have 2 supervisors that manage our call center. We have 2 supervisors that manage our intake and renewal team. We have 2 that oversee the long-term care team. We have a child care supervisor. And then my title is I'm the resolution coordinator. So I oversee all of our administrative appeals, and I also am the fraud supervisor. So I supervise our fraud for 12 counties, and then I have 3 staff that are on the benefit recovery team. So that's kind of how that works.
Yeah, and then she serves as that local conduit to the staff that are here in Sawyer County.
Yeah.
So it's a little bit different how her department functions.
Sure.
Everybody else is supervising local employees.
Okay. And this new electronic health record, is it shared by all these counties then that are involved?
No, this is, so Shauna's team actually is the only one that probably won't really use the electronic record. Everybody else will probably have a little piece of it, if not a significant piece of documenting in there. But Shauna's team, as we look through, they use a state system for documenting all that information into, so that all the data is there and ready to go. And then people can see that throughout the state, depending on what their needs are. The other thing that allows us to do, and I know I'm getting a little off topic, but just to let you know, that allows, there's a lot of quality control that happens within economic support. So a lot of listening on the back end and looking at how well they're processing not really claims, but processing applications and moving things through. So that's one side. Sarah's team on the CPS youth justice side of things also uses a state program to document into, but part of her team doesn't have that state system, so they'll be documenting within our new electronic health record. And Carol's team also, part of her team has to document within a state system. And then part of her team does not have anything to document into and will be using the new electronic health record. We'll be able to tap into, though, and do the referral process through there. Hopefully that is a little bit clearer. Any other questions in this area?
I have one more question.
Yes.
What do we gain by having this call center and we team up with all these other counties? What is the purpose of that if we're spending a lot of time and energy on, say, a large county that has a lot more call volume than what we would have? So we're spending our time, money, and resources on theirs. Why don't we just focus on Sawyer?
So, Shauna, do you want me to answer or do you want to go ahead?
Either way, I mean, I can speak because I was part of the local economic support when we just had it here solely in Sawyer County, and then also when we transitioned to the Northern Income Maintenance Consortium. Basically, it came down to from the state a budgetary issue, and most counties were not going to be able to run the economic support program without moving to a consortium base where we could budget the way that we do as a group. So that's why they went to this system. I know before that it actually, and I hate even saying this out loud, but it one avenue could have been that all these jobs went to the state, you know, and a company like, say, Hewlett Packard or something like that would get a contract and they would be the ones that would administer these programs, and then you would just have one local person, because that's still one of the requirements, is you have to have one person at least in each county to be able to accommodate a face-to-face appointment. Luckily this system has worked really well. I think we all had a little reluctance to go to this system, but it has worked out well. Back in the day when I started with economic support, you couldn't do an application on demand. On demand means a person can call between these hours and do their application right there on the phone on the spot. You know, back in the day, people would have to get an appointment, and maybe that appointment was 3 weeks into the month, you know, and they had to come in and meet face to face. So it's been a good change.
And to kind of speak to your point versus the smaller county versus the larger county, the amount of money that goes in is per capita based or per application based. So it is split out. So we're not putting in just as much money as a larger county like Wood County is. They're putting in a proportionately more amount of money than we would be in making those services happen. Does that help answer that?
Move on.
Okay, sorry. If somebody said anything, I missed it. So, okay, we're going to move on to reducing mental health out-of-home costs. We talked about this at the last meeting, I believe, or the meeting before that, about transitions. And what we are looking to do is be able to change the focus of transitions residential home to be focused more on our long-term clients versus short-term clients or clients that don't have as high mental health cost needs over the long term. So that is the trajectory that we plan on going. We will need to hire additional staff and get them trained up in DBT. These are just acronyms that you guys don't really need. We need to train them up for the people that will be in the home. So the specificities of what's needed for the care, that's there. I think I talked about this at the last meeting, that it's not like people have high physical needs. We just need to know how to deal with some of the personalities and the behaviors. It's not a hands-on restraining and all that kind of stuff that would happen in a potential inpatient mental health unit. It is more strategies of being able to work day in and day out with clients. And we want to be able to have competent staff in a safe living environment. We'll also need to look at the environment, make probably some minor changes, kind of probably reduce some things that are in there, put different locks in, but real minor changes to the environment to make it ready to go and make it a safe environment for who we are looking to be able to transition back. We've already started having these conversations with the clients that we'd be looking at transitioning back. And I've had some conversations also with other places that specialize in educating and running some of these homes. So we'll be working with them to make sure we have things in place to be able to be successful. So that should reduce our out-of-home costs for those long-term clients that we talk about every month.
So Julie, excuse me, I got a question on that. So then our cost of running transitions is going to increase, right? With the higher qualified staff, more staff? But we're looking at saving money at the other end then by not
Yes.
using Winnebago or Mendota as much?
No,
what
we
you're
have,
saying?
it would not necessarily be, well, Mendota is used with, would be on like the criminal side of things. So Mendota is kind of a whole nother realm that we're not talking about here. But Winnebago, yes. So like we could save some costs. We anticipate we'll save some costs because those clients who would go to Winnebago, who are the long-term clients. So sometimes even if we have them in a really good environment, people do end up getting into crisis and need to go to Winnebago. What has happened with us now is we have no control on that environment that they go back to, and they won't get them back as quickly or refuse to take them back. So by being able to change transitions into a place that we actually control who comes in and comes out, we're able to get those clients back much more quickly from Winnebago for that particular thing. The other thing is where we have them right now is $1,600 a day. Being able to bring those costs will end and they go right into transitions. We already have a cost of transitions right now. So we should see at least a 25% reduction, if not more, in the costs, even with adding staff.
Nice.
With staff is 24/7 there. We just need to add one more person.
Did they ever increase how many patients they can have there, or clients?
At transitions?
Yeah.
Yeah, at transitions right now we have 8. We would be reducing the number of clients and moving more high need clients into there and reducing that number. Now, as we've talked about this, and Marshall made note of it as well, maybe we need to be looking at a different environment where we're able to have people who need sober living and other things that are less high end that don't need 24/7. The problem with transitions right now, it's a 24/7 environment. The people that we bring in there as transitions, they don't necessarily need 24/7 something there 24/7. Would that be a better environment? And this is not in our strategic plan at all, but just a conversation. Would that be a better environment for like an apartment building where people rented apartments, but we had somebody there that was going in and managing and looking at things, like something that's less cost on manpower, but still provides that support? Other questions or comments in this area?
No.
Okay. Revenue streams. Using our new centralized referral process, we'll identify programs that best fit the client need while maximizing reimbursement. So right now, when something comes in, it comes usually right to one specific program. Our plan with the centralized processing is to look through to see what is the best fit and be able to maximize that payment structure. So some programs pay better than other programs. Would some of these programs work well for the client? So that's that piece of it. We will also be looking internally at our staff, and we've already begun having conversations on this to train specific HHS staff that we already have hired in CCS services so that we can increase our billing capacity. So we may be billing in a revenue stream that Carrie has helped us get started is targeted case management, where we weren't billing in some areas previously. We are now. but is there an opportunity to actually move them into a CCS billing structure where then we can maximize the revenue and providing pretty much the same service that we were providing. So that is a structure we're looking at. And then for referrals that have private insurance, we are going to look at, and have been doing this already, but want to continue to do this, to become a preferred provider. That way we're able to bill and get paid at a higher rate. And that's something that is new for us to be moving into that this past year, but we want to continue to expand that. Questions and other strategies?
I think we're good.
Okay. Uh-oh, did I miss one? Is there one more or am I done?
No, it's measurement, and you
Okay.
covered that.
There isn't one more strategy. Am I done, Lynn?
You had 4
Liz?
things. Yes.
Okay. Okay, thank you.
You had 4.
I think I probably wanted to like add a lot more goals because there's a lot of things we're working on, but we are trying to be focused in specific areas. And again, we'll look at adding other strategies as we pick things up along the way and updating these. We'll create a report that allows you to see where we're at and how we're obtaining our goals.
I think this is a really good start, and you put in a lot of work into this. Thank you.
Yeah, I
yes.
agree in it. And I think, Julia, very realistic, these strategies. I think they're doable, so thank you.
Yeah, that's the hard part. You know, we want pie in the sky. I have a lot of leaders who want to change the world, but we gotta do that kind of one bite at a time here. So thank you.
I did encourage the department heads to target measurable and achievable goals so that they don't get frustrated. And to keep it concise, like Julie did. 4 goals is perfect. You don't want to do more than that because then you get spread too thin, don't do it well. So she did a very good job on this.
Great, that's good to hear.
Thank you.
Okay, let's move on to Aging and Disability Resource Center.
Okay, I'm going to give a verbal report. And just so you're aware, I know I spent a lot of time in the strategic plan. We'll kind of minimize. You have reports in a lot of other areas. So if you have questions on any of the reports, you can let me know. But this one I do have a verbal report on for aging and disability. So our options counselors are continuing to be busy with counseling and functional screens. And right now, all of the ADRC of the North, so we are in another consortium with that. Everybody is seeing an increased activity, and this is mainly because of the holidays come around and family members start seeing their families and become concerned about their parents. And so then we tend to get a bump up during the holiday season of referrals into the ADRC. When it comes to dementia care, Joni is still presenting on the Dementia Detectives, which is on the radio. And they just finished their 6-week training of powerful tools for caregivers with LCO. And then Joni is also working with Weiss Community Library and the Dementia Journey Display Board. There's a caregiver corner in the library that the assistant manager is assisting with. Elder benefit specialist, Shannon Ewert, she is new in the area. She took over for Hank. She just finished her first Medicare open enrollment, which is very overwhelming for a new employee. She's helped 79 people in this year. 42 she assisted with enrollment, 79 she help them enroll themselves, and 15 decided that they would just roll over as their plan was working for them. Shannon has also started doing monthly visits with the Sawyer Senior Center meal sites. So she is going directly there and being able to connect with people that are going to the senior centers. The Yodex, so there are, we had purchased with some marketing dollars that we had received from grants, purchased TVs that would actually run different advertisements and things that are happening in the communities at the different sites. They have been, all of those have been moved to the different sites, and they should be up and running soon. And then our disability benefit specialist, that is actually a position that is held by Price County, but it's a shared position at Sawyer County. And Melody started, I believe, in just maybe a month or two ago, and is starting to come to Sawyer County on Thursdays and will increase as the needs increase. And then for adult protective services, we are continuing to work with the community. Rebecca is getting to know different areas in the community, working closely with law enforcement and other agencies. As we get the referrals up in the ADRC, they tend to also be dual referrals into adult protective services. So we are seeing an increase in caseloads there. That is that area.
Any questions? Let's move on to behavioral health.
Okay. All of the behavioral health reports have come in. An area of highlight is that CCS is getting up and running, and we're moving in getting that program moving forward. And the new worker, Chelsea, in CLTS is catching on very quickly and seems to be a good fit. Any questions with this report?
Is Alicia still working?
Alicia is on the line.
Oh, Alicia.
Hi, Lorraine.
How you doing?
How are you?
Good, you?
I'm glad you're back on the board.
Yeah, thank you.
Is there any other updates that I missed that for a highlight in the area? I think those might have been the two things, Alicia, that were key.
Yeah, this week too is a big week for our state review is going on this week.
Right.
So it's been pretty jam-packed with the new EHR, having one longstanding employee leave, training in a new person, having a state review, just all kind of in a matter of 3 weeks, but we'll get there.
Mm-hmm.
Yep, great employees that are moving things forward. Okay, community support program and mobile crisis. There's really, it's the standard report. I see that Caitlin is on, if anybody has any questions.
Seems like the community support program, there are more people involved with that in this last month, at least for October.
For CSP or for crisis? I thought our numbers were pretty.
I think the CSP numbers have remained pretty consistent. We've been between that 45 and 50 number.
Oh, okay.
But we have had a lot of movement, probably the most movement I've seen on our consumer list since I've been working with CSP. A lot of new faces in our program and some clients that were with us for literally decades that ended up passing away or kind of being moved to different, more appropriate services. So there has been quite a bit of movement, yeah.
Julia, will this person also be a referral to the new transition house? Do they have to go through this support program mobile crisis person?
No.
No, not affiliated with transitions at all.
No, well, okay, there is a little affiliation. That they don't have to go through mobile crisis to get into transitions. Transitions, we're going to really focus in on those that we know are our long-term clients that will need to be served for long. They're not going to. We have a lot of people who go into crisis, go to Winnebago, maybe do a step down, and then move back out into the community, and they continue to get consistent support then from the community support program if there's high mental health needs, because they're able to assist with medications and helping with daily things in their lives. So that's the community support program. I'm not quite sure if I answered the question.
Yeah, thank you. That helps.
Okay.
Let's see. All right, where are we?
And then it's our standard mental health monthly expense report and the mental health cost by client report. That hasn't changed much at all. It's pretty consistent month to month.
All right, let's move on to Child, Youth, and Family Services then.
Okay, I'm going to give, I have a report in there that's not going to be in there. Okay, so for Child Protective Services and Out-of-Home Care report, actually, I'm just going to give a verbal report for this very briefly. My report is that Susan, who is our contracted CPS supervisor, has been on site. She's here Monday, was here yesterday, today, and tomorrow morning. And we met and we had a very good conversation. She works with multiple counties and has had experience along the way, seeing how different departments run and what things are doing. And I just wanted to give a big kudos out to our team. She is very impressed with and maybe I should just step back and do a reminder that in beginning of 2022, when Susan came on to help assist us, there was Sarah in Youth Justice, Carla, and Erica, and that's all we had. Our team was completely decimated, and we had to start from scratch. So all the rest of our employees are brand new. And she has been extremely impressed with how they've grown in their documentation practices, how they've grown in their ability to present themselves in court, and specifically how they are stepping up over and above to help out these families to be successful, where in other counties she sees people just complaining that they have to do this or do that and don't want to take those extra steps. So I just want to give kudos to the team that they're willing to go over and above to make sure that we have the best opportunities of success rates with these families. So that's my report in that area. We do have a diversion or a truancy report. I know that was asked about last month, so I actually will share an image on this. I do want to, I'm not sure if we have YJ numbers in there. We'll put YJ numbers in next month. The Children in Care expense report is one that needs, I missed that, it should be eliminated. That's the report that Kathy Garby used to do for us that we have to somehow recreate and come up with some meaningful data for you. Okay, so I need to get a PowerPoint up here and replace current share. And then we'll go to the slideshow, and we have Sarah on that will be able to speak to, what am I sharing? I'm sharing my, I'm probably sharing my wrong screen. Sorry. There we go. Now, are you seeing just the PowerPoint slide?
Yes.
Yeah, I'm seeing Shauna nod. Okay, Sarah.
Yes, good evening. So yeah, we put together a truancy / our new diversion program, some different slides to better explain how things have been going. And I would say we're very happy with the progress that we're seeing at such an early stage. So for the total number of referrals we've received for the year 2025 is 34. And just reminding everyone that we didn't get a good start on this program until probably May of this year. There was just some barriers in the beginning where we couldn't get out enrolling as quickly as we would have liked to. Right now, we currently have 27 youth enrolled in our diversion program. We have 4 youth that are pending intakes, and there are a total of 8 youth that have discharged. This ranges from different areas of 1 youth had moved to Minnesota, 3 youth had turned 18. I think 1 went to the Challenge Academy, and just some different areas where they were going to be discharged. But we were able to also gather some information and data specific numbers where we're able to look at how many of those 8 youth who were discharged reported like better mental health, more confidence in going to school, better relationships with families. And I think that's on another slide that's coming up. So this graph indicates that of the 27 youth that we currently have enrolled in the program, we have 10 students who have had 100% attendance for this school year. So from September till now, 10 kids have not missed 1 day of school. And I think that's a number to be really proud of, because even though we're working with 27 kids, truancy there's no easy fix to it. And it's really getting in and talking to kids about the root of the problem and trying to help support that. So I'm really happy that there's 10 youth that still have 100% attendance. And then you can see the rest of the graph. It shows the additional numbers with 90%, 80%, 70%. We still have, I think the number was a total of 3 who are under 50% attendance. And these are youth that we're continuing to try to be creative. We're, working with our court system on different avenues that we can take to make this a little bit more serious than it is. And I think overall, it just shows really good progress. Sorry, I have to keep moving my screen back and forth so I can see where the numbers are. These are the age ranges of the students that we're working with. So we have 3 that are under 10 years of age. We have 8 that are 10 to 12, 14 that are ages 13 to 15, and then 2 that are 16 to 17. So this is the area that I was trying to remember all the statistics in a couple slides previous. But of the 8 youth that we have discharged, 6 out of 8 report higher self-esteem, 6 out of 8 report feeling more engaged in classes and with teachers, 5 out of 8 report notable improved relationships with their parent or caregiver, 6 out of 8 report having a more positive outlook on their futures. I think that the totality and kind of overall picture of this new program shows that we can say it is making a positive impact and difference. And I think the more time that goes by, we are really going to start to see some decline in our delinquency numbers and the areas that youth are struggling enough that we need to place them out of their homes and those out of home costs. I think we are in the very beginning stages of being able to see those numbers decrease over time. All that being said, and whether we're talking about youth justice or we're talking about diversion, just kind of piggybacking off of what Julia earlier shared in regard to just the staff in this unit, that we can't give them enough kudos. They are rock stars. They go above and beyond every single day. There's not one worker, I think, that I could say I could find another worker that could do the job better. Like, I have the gold star team and I'm so proud of them. So definitely want to recognize them tonight as well. We also had a meeting with TGB today. We felt like it went really well and a lot of good discussions were had and really getting to know one another. And I think, I started this position in 2022 and I feel like it's been kind of a long time coming, but there's been so much going on. I'm really glad we got to sit down today and collaborate with them. And we are going to plan to meet on a quarterly basis just to touch base and, talk about the progress of different ideas or different things. Just kind of keep that ball rolling together. During that meeting, we did talk about, like Lorraine mentioned earlier, that they are looking for donations for their active military members. And we are going to be asking our diversion youth and youth justice youth, if they want to get some of their community service hours done, they could either make something to be sent in the box. They could write a letter. I'm sure people would really appreciate that. And if needed, we could have youth go and help package and get things ready to go. So just some exciting things that we have going on as well. Any questions for me?
I think about the 10-year-olds that you mentioned. Yeah. So do you work with the parents of those youngsters? Because they're not making any decisions to stay home.
Yep.
Wouldn't think.
You're right. So, I mean, at 10, they're it's hard to believe, but they're already starting to make those decisions. But what we see is that when kids are 5, 6, 7, 8 years old, and it definitely is the parents at that point in time where the foundation is being built as to, they're either going to build structure and the expectation that their kids go to school on a regular basis. But if it doesn't matter, if they're staying home and not enforcing them to go to school, then that foundation is also being built. So when they are younger, it is a lot of work with the parents. And, once you start getting into more so middle school and high school age kids, it's a lot of work with the youth where that's the main focus, but there's still some work with the parents too.
Thank you.
I just wanted to say we did have a good meeting today, and the tribe appreciates all the efforts that are being put out there to help prevent, intervene, do whatever we can with our young people, and to help them stay on a good path and that healthy path, and to get educated, be in school, all those good things, and to address the concerns that we're seeing when it comes to the AODA issues and those unhealthy behaviors and those kinds of things, and to be able to have the supports that are needed in all areas. I think that is really good to keep moving forward, and we're already seeing results now. And so we really appreciate that and support that.
Thanks, Lorraine. Anybody else?
Let's move on to economic support.
Any questions related to economic support and any highlights, Shauna, or anything outside of your report that you want to highlight?
I'll just highlight that, of course, it's that time of the year where we're getting referrals from the federal marketplace applications. So we are extremely busy right now. They have okayed overtime for a couple weeks here in December, and most likely will be afforded at least a week or so in January just to try to manage the influx of those applications. And then, of course, the government shutdown did increase our workload as far as the calls coming in and when people were getting their benefits. So we're managing the best that we can, but our call times, I will expect that our call wait times and answer rate will be increased for this month. And I can answer any questions you might have.
So are these benefits going to continue then? Are you anticipating any kind of concern in the near future?
Well, Lorraine, we are not given very much information. What we've been told so far is that, and here we are on the 9th of the month, we know benefits for December are being issued. And that's what I've been told. Have not been told anything about January, unfortunately.
It must be a very confusing month because there's so much in the government that's being thrown out there in the news about things that may change. And so all these people that are being processed, that may change again.
Right. And this is a hard time of the year. And it's just been extremely, I feel for our community, but I also feel for my staff, even our energy assistance program. Those payments are just now being released this week. So all of the applications that we've had, the money is just being dispersed this week.
When did that open?
So the heating season opens October 1st. And we send out early applications. So we mail out applications in September, and we are ready to go because we have a number of households that are on a fixed income. Those are easy applications for us to process when we can verify income, with the data exchange, and there's no change year after year. So we try to get through those as quickly as possible. And, we've processed a lot of applications, but until this week, there weren't funds going out.
Okay, let's move on to public health. Is Julie here?
I am. Can you hear me okay?
Yes.
Okay. I did want to report that we had a winter storm that affected power in Sawyer County on November 26th and 27th. Members of the public health staff, our emergency manager, as well as Julia, met 4 times over the course of those 2 days to monitor power outages, to send out public messaging. The casino was open for warming, so we messaged that out for community members who may have needed that service. We also monitored oxygen-dependent individuals. I think we had 1 call for that during the winter storm to dispatch. So just wanted to give you an update on that. Thankfully, this winter storm was short-lived, and thankfully, families were able to get power relatively quickly. So it did not have the same impacts as the winter storm of 2022. Any questions?
So you're working closely with the tribe then, right? When you have these times of need and take care of as many people as quickly as we can?
Absolutely, absolutely. So we have a number of contacts. I know working with Jason Weaver, with emergency management there to make sure that we're messaging correct information. Interestingly enough, on this winter storm, we saw some intermittent power where power was coming back on and then going back out again in spots. So we monitored that closely and did message out the information that we had regarding warming. Thank you.
Okay, so Julia, do we need to talk about our budget performance? The end of the year here?
I would like just to highlight, we won't go page through page. I just wanted to kind of talk about some of the things that are happening right now. Some of the expenditures that we're having in long-term care, elder abuse area, are expenditures from those Chapter 55s, which we should be able to recoup some funding from. So that is kind of an expense out and reimbursement back in. So we'll be monitoring that. Some other things that are happening. Well, we've already talked about kind of about the plans for the mental health clients, but looking at Sarah's area in youth justice and looking at the CPS area, we are starting to see some transitions of kids that we've had in residential for quite some time, starting to transition back home or back into a much less, or actually maybe even out and of the system altogether. So kind of working through that process and what that looks like. So hopefully those expenses we'll definitely see some reductions in those areas. We do have a couple of kids that had come in the meantime. So hopefully that will start looking good in the beginning of 2026. And then just kind of really still kind of working on some of those strategies of how do we transition people out of Winnebago more quickly into environments that we have better control of. Also looking at being able, and Joe, Caitlin, and I talk about this, is like, how do we get them in areas that if we can get them into someplace that will accept their medical assistance, that is really the goal. Winnebago at this point still does not accept medical assistance. They have over 16 beds, and so medical assistance does not cover that. The state has applied for that waiver, just as a reminder, and we'll keep an eye on that. Once that comes into effect, that should help us because then medical assistance could be accepted. And those Winnebago costs will be much less. So I didn't even bank on that when I was doing any of the performance planning or strategies, because I don't know how long that's going to take. And just with everything that's happening in the federal government, I don't think that's something that we want to put on like, yes, that's absolutely going to happen. It'll just be something that'll be a great benefit for us should it happen. And a reminder also that those that are in Lincoln Hills and or Mendota, who were $1,500 a day, those costs went down to $550 a day, I believe. So that is helping us as well in that area. So just kind of some of those outlooks as we move forward.
Yeah.
Wasn't that?
Carrie, did you have anything that you wanted to add when it comes to where we are with some of the things you're seeing in the budget? You're kind of working on that revenue stream side.
Right. Yeah. No, I mean, I think the only thing to add, just to that revenue stream is, we have been seeing some of those case management revenue payments come in the CPS and YJ area, which is new, that we added the second part of this year. So those funds are starting to finally come in to help contribute to the budget. So that is definitely a success we've had. Other than that, I don't have anything else, Julia.
Okay.
I have a question.
Tweet.
Yeah, Julia, Fund 258, which is agent in the state, has that been keeping up, or do I see a deficit there?
So we should be keeping. Oh no, I got to go to my screen because I can't see that screen well enough. When I'm looking at that, we should be covering our costs in that area.
No.
So I have to go back and look because we were on target.
Okay. Because I know we did increase our fees for some of that, right? To try to keep up with
we
this?
did. And to speak to that going in, yeah, because I thought we were more on target than that. To speak to that, we will be doing increasing in our fees as we move this into this next year. There was big changes on the state side on the agent program. So that then, now that we're having a meeting in January, that will be our focus of discussion, is looking at and kind of briefly go through that. They're actually restructuring how some of these places are. So it used to be a TRH was a tourist rooming house, but now they're going to be lump summed in the number of units that they have, and those fees have increased. Some of the places that were licensed as motels, hotel kind of lodging, because those had resorts with cabins, they'll be moving into tourist rooming house kind of structures. So it's going to be a pretty big change on the lodging side, but there's also some significant increases that we'll be looking at as well. The state also will be collecting 14% of those fees. So whether we increase our fees or not, they are still taking that amount of money. So we're going to have to make sure that we are looking at that and making sure we get our costs covered. So that is something that we are working on over these next 2 weeks. In fact, I think Matt just sent me some information, Julia me some information this evening to be able to look at so that we can do some forecasting on what that is.
Good, thank you.
Mm-hmm. Otherwise, I was going to try to keep our meeting short, but I talked a lot about the strategic plan, but I do appreciate all of the input, and I'm glad to hear that you guys want to stay engaged and meet with us monthly. So very happy for that as well.
Okay, thank you, Julia. We'll move on to number 18, board appointed committee updates. Do we have anything? Do we have any correspondence or reports from conferences and meetings? Future agenda items. Anything that anyone wants to put on?
I have a couple of the takebacks from the strategic plan. I don't know that we need to add it. We'll just make sure the strategic plan is on there, and I will, I wrote those notes down.
Okay. We're adjourned.
Have a Merry Christmas, everybody, and Happy New Year.
Yes.
Stay warm.